Good afternoon. Hey everyone, so I am working from home today. Um, it was a bit gloomy and raining outside, so I didn't go out to do any marketing today. But I just wanted to drop in here and answer any questions that you have on marketing. So I can, help guide you in the right direction, because I know a lot of us are wanting to get clients, right? And it's important that you have a structured marketing plan. So I'm here to answer any questions that you may have on marketing. So I'm gonna give it a few minutes. So today I decided to work from home. I'm the caregiver for my mom too. So she has a doctor's appointment at 2 o'clock. So I just decided to chill at the house today, do a little paperwork. You can do that when you have a systems in place. You can work from home if you need to. I really haven't been doing anything home care, doing some other things with coaching and consulting, some courses that I'm doing in my school platform, my school community. So I am doing those things today. But I just wanted to drop in here because today is Marketing Tuesday, and I wanted to make sure I stay consistent, because that's how we have to do in our business, as well as marketing, is being consistent. But one of the main reasons people have a hard time getting clients is that they're not consistent, and they give up too soon. Give up before they get a client. They say it's not working, the marketing isn't working. But is it the marketing that's not working, or is it that you don't have a structured plan on what to do for your marketing? So I just want to give a few tips on what to do when you're out marketing. So number one, you need to make sure you're going to the right places, right? We want our marketing to be intentional when we're going out to try to build these relationships. So we want to make sure we're pre-qualifying before we even go to these different places, because you just don't want to be all over the place, going different places and not making any type of progress. So number one, make sure you are pre-qualifying, finding out what type of facility you plan to go to, and just a little research on that facility and where you're going. What type of clients do they serve? Because let's just say, for example, your goal is to get private pay, because if you're just starting your home care agency, you have to have your home care agency in Georgia at least 9 months serving private pay clients before you are even able to apply for Medicaid. And the Medicaid rates are low in Georgia, just probably everywhere as well, low. So you want your goal to be private pay clients. But first you want to pre-qualify, find out what type of facility it is. Find out, are they Medicaid heavy, or they have a lot of clients who maybe a rehab facility and they're on Medicare. So it's important that you know information about Medicare, Medicaid, how that works, because most of your Medicare clients are going to be the ones who are going to be your private pay clients, because they can't afford to get Medicaid. Well, they make too much to get Medicaid, so they don't qualify for Medicaid. So those are going to be your private pay clients. So finding out, is it mostly Medicare? Do they accept Medicaid? What type of facility that you're going to market to? So first, do your research before you just go into these different places, handing out your brochures and hoping to get a client. So my tip, number one, pre-qualify the places that you're going to. The second thing you're going to is once you decide where you're going, what's your goal when you go there? Are you just going your first day to do an introductory meeting and drop off some brochures? Is your goal to go there and, be able to schedule a lunch and learn, or be able to meet with their entire staff. Like your initial visit. What is your plan for that initial visit, and how you plan to introduce yourself when you go in? Most of the times when I'm going into a new place, I let them know, hey, my name is Erika, with Lily's Helpers Home Care, and I was in the area, and I wanted to drop in to introduce myself and learn about your facility. And if it's the, home assistant living, finding out, if the activities director is there, that you can speak with them and see about getting on their activities calendar, so you can learn more about their facility and get to meet the people they have in their facility. So just have a plan when you go to that initial visit. How do you plan to introduce yourself? So number one, pre-qualify. Number two, be thinking about how you're going to plan to introduce yourself once you go into these facilities. And number three, how you plan to follow up with. Just like when you meet someone, right? You meet someone and you have to get to know them. You have to find out who they are before you even can trust them. So going in already knowing, this is their first time meeting me. This is my first time meeting them. So I am going to have to develop some type of relationship with this person in this facility so that they can trust who I am, trust my agency, and be able to refer out to me. So number one, pre-qualifying. Number two, thinking about how you plan to introduce yourself when you go into that facility. And number three, how do you plan to build that trust with those people in the facility? Again, if it's like a senior community, assisted living, you can schedule to get on their calendar to come back and do a activity with their clients in that facility. But you also want to make sure you're following up at least every week, right? So I go into a place, let's say today, Tuesdays, my marketing in Columbus, when I normally go. Next week, I'm going to, well, as soon as I go home, right, if it's my first introductory, I'm going to get their email, their information. I'm going to follow up within 48 hours with the email. Hey, it was nice meeting you on today. Can we schedule lunch or whatever it may be, but a 48-hour email to them. And then I want to go back that next week, and you want a reason to go back. And what I have created with my coach, because I have a coach too who helps me with marketing as well and branding my company, we created some educational material. So each week I go in, I can ask them, hey, have you joined our YouTube station, and give them the flyer for that. Or I'll go back in and just bring them some information, education material, but just finding a reason to go back every week, because you just don't want to drop in and what you want when you drop in, because they're busy. They really don't want to be bothered. But knowing how you plan to follow up on that next visit, you can take a goodie, depending on, we have these different healthcare days. So you can take a little goodie. You can get like a little cookie and put your business card on it. I'm just dropping by in the neighborhood again, just checking in to see how you're doing. Do you have any potential discharges that are going out this week that may benefit from home care? You just got to ask, at this point, when you were ready for clients and you don't have any clients, be bold and just ask, hey, do you have any clients who are going to be discharged this week who's going to benefit from home care? And you are consistently going in each week, that scheduled day to visit that same facility. So do that, build your relationship, and know that it takes time, right? I can't guarantee, with me doing marketing and putting these tips in for you every week, I can't guarantee that you're going to get a client like tomorrow, but you possibly could, right? You just don't know how God works. Well, you do know how God works, I'm sorry, because he can send you a client. You can have 0 clients today and 5 clients next week. But just know that all things take time. It takes time to grow your business. It takes time to build those relationships. But it's up to you to make that consistent follow up with those potential referrals and making sure you are correctly pre-qualifying those places that you're going. You don't want to be out here doing this unintentional marketing and you're not getting any movement in your business. So think about those places before you go. And this week, this is what I want you to do. I want you to think about 5 places that you went to in the past, to either introduce yourself, left brochures, or whatever it may be. 5 places that you've been. Now, if you can't even name 5 places that you've been to within the last 30 days to market your business, then that's a problem, because you aren't even doing the work to even get a client. So 5 places or people that you've met within the last 30 days. And I want you to do a follow-up with them. Either another visit to them or another email to them if you are unable to drop in and visit. And then I want you to, after that, I want you to put that person or whatever facility that you reached out to and you just dropped in on this week, I want you to add a date on your calendar, whether it's every Wednesday or every Friday, to consistently follow up with that person, whether it's a drop-in visit or an email or a phone call or a text, to stay in contact with them somehow the next few weeks. We're going to say the next 30 days, so the next 4 weeks, and see how that goes with at least starting your marketing and being consistent, and then go back after these 30 days. If you see there's no movement right now, like what could I have done different? What can I do to grow that relationship with that individual or with that facility? The next thing I want you to do is, so that's 5 people that you have connected with in the last 30 days. I want you to either drop in on that facility or send an email, make some type of contact with them. The next thing I want you to do is find a place, senior center, assisted living facility, independent living community that you can drop in within the next 30 days, these next 30 days before May is over, because April is over, and do an activity with that facility. So do an activity with that facility. And then the last thing I want you to do is create a list of, we're just going to say 10 people and places or people or whoever that you want to connect with in May. 10 people or places. So when I say people, is it a case manager you've already connected with? Is it a marketer you're already connected with? Or is it you need to go to a home health a home health company and get on their weekly meeting to come in and do like an in-service for all of their staff? So that can be maybe 10 people in that one room that you can connect with. But 10 people or places that you want to go to within these next 30 days. And once you visit, you're going to send a follow-up email within the next 48 hours of visiting those people or places. And then you're going to go through those 10 places or people and see who aligns with your avatar client that you are wanting to have as part of that you want to service. Which one of those people or places you think would really be a great partnership for you? Whoever they are, let's narrow it down to maybe 5 people or places, and you are going to have a consistent schedule to go to them each week for the next 90 days to make sure you are building that relationship with them. And after those 90 days, so that should be a good 15 people. Yeah, first 5 people, and then the 10 places. And, if all of them work out, they have your avatar client, find a way to network with all of them each week, partner with all of them. But let's keep it easy. So get them on your calendar and be consistent with doing follow-ups with them. And over the next 90 days, just be consistent. Be consistent. Be consistent. So that's how you can do that, those relationships where you got to get out and just connect with. But other things you can do is just making sure, you have a good profile, a Google profile where people can find you on the internet. I recently met someone and they didn't even have a Google profile set up. And what I've learned is those reviews are important because there's a lot of people that's not even on Facebook, that's not on social media, but they are Googling in-home care support. They're Googling senior care. They're Googling senior care. They are Googling those things because they need help. They're Googling dementia. They're Googling Alzheimer's. And is your agency showing up when they're doing those? When they're Googling to try to find care. And the first thing they're going to do, because all of us do when we start to Google things, is what are the reviews on these places? What are people saying about your agency? And one thing we started doing is asking for those reviews from our clients and our caregivers. If you go to our page and you look at our reviews, you will see recent reviews from clients and caregivers, because this in our system, right? This in our process of how we communicate with our clients, how we are reaching out to them, how we are creating those loyal clients and those loyal caregivers. Because, in business, we're not perfect, but our goal is to work in excellence. So our clients that we have, our caregivers that we have, they know that we're not perfect. So a client, they understand that people call out. Sometimes there may be a breakdown in miscommunication, but we're going to consistently follow up to make sure we are putting those things in a line, making sure we are communicating with them when things happen, call outs. We have a consistent process for it. So those clients who are able can go in and do a review for us when we are doing our customer service calls. So are you doing customer service calls, or are you just putting in all the work, working hard, and not asking your clients for reviews? Along with your caregivers, are you asking for reviews for them? They're working for you, right? You are hopefully compensating them to the best that you can as far as what you can give them in a service-based business. And you are also, providing education to them. You are giving them perks, right? Maybe it is sick time. Maybe it is paid time off. We recently ordered gas cards for all of our caregivers. And we're going to give them out Friday. But here's the hint. We have a staff meeting Thursday night. It's via Zoom. And those who make sure they're on that mandatory call, we'll get that gift card on Friday, because our Friday is we're starting back, since it's about to be warm outside, our fun Fridays at Lily's Helpers. So on Friday, we are going to be doing Fun Friday, and for this first Friday, we're gonna give everyone $20 gas cards, and we're gonna have some treats within the office, because it's Mother's Day month too, right? So we're gonna have some treats in the office to give out to them. But in order for them to receive it, they are going to have to make sure they're on that call. Just as if, they want us to be able to reward them for things, we need to hold them accountable for things. So if they miss that mandatory meeting, they will get an attendance point as well, and they won't get a gift card. But for those who are compliant, we are making sure we want to compensate them to the best that we can, and making sure we're contacting those caregivers after 2 weeks when they first start employment, then after 30 days, going out, checking on them, see how they're doing, and asking them for reviews as well, because caregivers as well, when they're looking for employment, they are going on to your Google review, Indeed reviews, and seeing, is this the place I want to work for? So building relationships with them as well, your clients, your caregivers, and most importantly, going out to referral sources and building those relationships. And always remember, as much as you are marketing for clients, you need to also be marketing for caregivers. So that's why I say those Google reviews are important, because you don't want someone to start you don't even have. Now you got to run and find a caregiver to be able to work that client. So that's another whole lesson that you can get in our school community. So those are my marketing tips for today, and I'm gonna stay on a couple more minutes. I'm gonna try to stay here to about 12:30 just to see if any questions pop up, because people say other business owners don't want to help them, but I'm live right now, and what questions do you have for marketing? Today is Marketing Tuesday. What are the tips that you need? So I did give you a few tips. So let's see what other things you can do for marketing that I have tried. I've tried radio ads. I'm actually doing a radio ad, and that's more for branding. I've gotten caregivers off of radio ads. We've done the live setup where the radio station come out to the site, and they do the pizza. Those things do work for branding. And I'll say I did get one good employee from doing that live remote radio with the radio station coming out. So I've done that. That works for branding, I think, getting your name out there, because I run into a lot of people and they say, oh, I heard your agency on the radio, and caregivers call for interviews and things like that. I'm currently doing a commercial. So commercials, again, they work. I've gotten more clients from commercial for our adult day health program, because we do have an adult day health. So I've gotten clients from that. Not too many clients for home care, but I do run into a lot of people that say, I've seen you on your commercials. So now I'm getting into digital marketing, and I'll have to let y'all know how that goes. And digital marketing, it's a bit costly, y'all. It's like $2,000-3,000 a month just for digital marketing. And I'm trying it because I want to make sure our presence is in our new location, so we can, build that just like we built this location. So I'm gonna let you know about digital marketing and how that works. I've done, how at the bus stop you see your names on the benches. I've done that. I have done, the sports event, being a sponsor for those things. I have done, you name it, I've done it, I've tried it. So that's why I am here for you today, Marketing Tuesday, to answer your questions, because I'm sure I know how I hustle. Whatever it is, I have more than likely tried it to see if it works to get a client. And thankfully, it has built our brand. So, I can take a day out from marketing because referrals are still coming in. Referrals are coming in. And guess what? I got a team at the office to manage them when they're coming in. We're answering our calls. Make sure your phones are working, because we recently switched from Cox to Verizon. And I'm about to take those boxes back and everything, because that one talk phone, I prefer not to have it. I'd rather have, because the one talk for Verizon, it just forwards the phone calls to cell phone to cell phone. So you don't need an actual phone in your office. But when I was at Cox, we had an actual phone in the office, but we have a Freedom Voice number. So I was still able to forward those calls to, the call would still go to the next line if someone didn't answer. But I just don't like the one call, because now in the office, if someone doesn't answer their cell phone, and maybe we just haven't figured it out yet, we don't know how to transfer that call to the other person. So maybe we need to go back and read the instructions. But this Verizon bill is killing me, honey. I need to go into the office and find out what is on this bill, because this bill been like $600-700 a month for Verizon. So I'm about to take them all those cell phones, the boxes and everything back, because I just can't continue to pay that much for phones and internet. But that goes back to say, are you looking at your financials? Where are your financial needs in your business? And looking at monthly, every week I look at my financials, right? Every day I check my banking account, checking account. But every week I'm looking at those financials. And I admit I haven't done it always in the past. But when you are growing and you see how much your company is bringing in, and you trying to figure out why it's not going in your pocket, you will start to look at your financials. So weekly I review it, and I've been looking at some things that we need to cut it, right? Cut it. Yeah, they too high. The prices are too high, and I gotta cut it. So Verizon, yeah, I'm coming for you. And what else? We have like Scan 123. We have Access Care. We got a lot of apps that I'm looking, that I've signed up for, that I gotta cut before next quarter. Because we have one platform that's able to do all of it, which is Access Care. Before we had SwiftOps, and shout out to SwiftOps too, because they're a great CRM system. But we switched to Access Care only because for me, it's able to look at the amount of clients better, based on better than the billing hours each week. So I decided to switch to Access Care. But SwiftOps is awesome too, especially if you're just starting out and you don't have a lot of money to put in software. But I'm off subject. So back to marketing. So I've done all of those things: commercial ads, radio ads, the benches, sponsorships, everything. But what works and what you really don't want to depend on too much is word of mouth referrals. That's like through your caregivers, through your clients, just people knowing who you are. Those are important, right? And you'll probably get a bulk of your clients from those word of mouth referrals, but you don't want to depend heavily on that. You want to know that you have some partnerships with other people who's going to refer you out to people. So marketing is hard. You know, you have a lot of people, or I've been seeing a lot of things that say these clients, you can get these clients, you can get these clients, but it's not easy. It is not easy unless you have, again, built partnerships and relationships with people. But if you're just starting, it's not easy, and you need some support to help you, to make sure you're consistent, and making sure you're doing the right things. You're being structured to get clients. So if you're looking for a community where you can grow and you can get some feedback and some help into growing your home care agency, I have a school community. It is called School, SKOOL. I'm gonna put it in the messages. School, and it's Home Care at Night. I'm gonna put it in here. And it's $27 to join, because we got different lessons in there. Every 2 weeks, do a live like this. You can jump in and ask questions, and I'm coaching on those Thursdays. But yeah, the school is where it's at. So before I jump off, it's 12:30. Like I said, my mom has a doctor's appointment, so I'm about to go and take care. And that's the freedom, again, of having systems in place, having structure in place, because I can, and then not having to go to work, right? So you got to get clients so you can possibly get away from that full-time job and be able to have freedom. So I'm just blessed and thankful that I'm able to have this freedom to be able to take my mom to the doctor's appointment. And she has caregivers too, but I take her to our doctor's visits. But just being consistent. So again, your work for this week before next Tuesday, I need for you to think of 5 places that you've been to within the last 30 days. Go back, drop in this week before Friday. If you're unable to drop in, send some type of email to them as a follow-up for those 5 people that you visited in the last 30 days. That's number 1. Number 2 is to, again,